Hi, my name is Kristen Locke, and for my newborn teaching assignment, I will be talking about newborn infant screening exams and the importance to doing them prior to hospital discharge. For this video, I will be using my very own newborn puppy, making her acting debut, Rosie the Dalmatian. Yay! Rosie is an expert at newborn puppy hearing screenings because she had one done when she was 6 weeks old. This is because Dalmatians are a high-risk population for hearing loss, so they make sure that they are either hearing, unilaterally deaf, or deaf prior to homing them. Some risk factors for humans, however, are genetic predisposition, exposure to a medication while in the womb that can cause hearing loss, or illness by the mother during pregnancy. Other risk factors may include premature birth, low APGAR scores, jaundice, or low birth weight. All newborns should be tested for hearing prior to leaving the hospital, whether they have these risk factors or not. Hearing loss is a common disorder among infants, occurring in 1% to 2% of newborns. So a common cause of this disorder is a malfunction of the auditory nerve, possibly due to those risk factors we just discussed. So a nurse can do a quick assessment on hearing either in postpartum or in labor and delivery right after the infant is born, quickly by speaking in a high-pitched voice or making a loud noise. So, Rosie! She's obviously not going to respond. She is hung up on this phone. So all newborns should have further hearing testing done prior to leaving the hospital because they may have hearing in only one ear or they may not have any hearing at all. So these tests are completed by a medical assistant or a nurse who has received advanced training on the equipment used. The early detection of hearing abnormalities can help prevent trouble with speech, language, and social skills later in life, according to the CDC. So there are two hearing tests that are commonly used. One is called the auditory brainstem response, which is called the ABR test, and that's the one we're going to be focused on today. The other one is called the otoacoustic emissions test, which we are not going to be paying as much attention to. So the ABR test is a test in which 4 to 5 electrodes are placed on the infant's skull, like so, and a noise, a click, is done to see if the infant responds. So I'm going to take Rosie's bone away and see if she responds to the clicker that we have. So this clicker is used. Rosie is trained so that she should respond, but a hearing dog will be able to hear it and a deaf dog would not respond. So let's see. She sees the treat. Okay, did you see that she kind of looked? That's one thing that we would not necessarily be looking for while completing the ABR test specifically, because we're focused on those electrodes and the information that it gathers in the moments before and during that click. So I want to show you Rosie's ABR test results from when she had her ABR test at 6 weeks old. If I can bring the computer up, you'll see that the test results show no hearing in the right ear and hearing in the left ear. So we'll be looking at these results to look at exactly what's going on. By looking here, you see that 3 clicks were delivered, and here are the response from those electrodes that were connected, showing the waveforms. So these waveforms on the left ear, you can see that it's a very positive waveform. It goes from the baseline, and that indicates that the auditory nerve is firing, and Rosie is able to hear in the left ear just fine. However, when you look at that right ear, the waveform is not as pronounced and is pretty flat. That shows that Rosie has hearing difficulty in the right ear. When it comes to an infant, how it would look would be, if the infant is completely hearing, both the left and right ear would look like this. If the infant has no hearing and is deaf, it would look like this. Pretty flat lines on the right and left side. In Rosie's case, she's unilaterally deaf. So one shows no hearing and the other one shows complete hearing. So if an infant were to show this, when we do that hearing assessment initially in postpartum or in labor and delivery, they would respond to that hearing test. So that's why it's important that we still complete the OAE or ABR test to see exactly what their hearing status is. In a case similar to Rosie's in an infant, as I said, this is what they would look like if they were unilaterally deaf. So they may be unable to locate exactly where a specific thing is, and they may have to just adapt and find a new normal. The possibility of unilateral deafness is one of the reasons why ABR and OAE hearing tests are so important and why hearing tests should be completed prior to discharge from the hospital. All right, thank you for your time, and at this time I will take any questions.